All right, let's talk about money in a skilled nursing facility, or a SNF. You'd think it all starts when a bill gets sent out, right? Nope. The truth is, the revenue cycle kicks off the second a new resident walks through the door. So today, we're going to trace that entire journey and figure out how to turn what can be a really leaky pipe into a high-performance engine.
And this idea right here, this is the absolute core of everything we're talking about. A facility's financial health, it's not just some accounting thing that happens in a back office. It's a living, breathing process that starts at admission. Every single step we're about to walk through is built on this one critical foundation. Okay, so here's our roadmap for today. We're looking at the 10-stage SNF revenue journey. You can think of it as the complete life cycle of a claim, from that very first hello at the front desk, all the way to crunching the numbers and making the whole system better. So let's dive right in with stage 1. First up, stage 1, admission and eligibility verification. This is the starting line, and honestly, it's one of the most critical steps. Before a single bit of care is given, the facility has to confirm, really confirm, that a resident is eligible for Medicare or Medicaid. It sounds so basic, right? But this is the very first spot where that leaky pipe can start dripping revenue.
And check this out. This shows the problem perfectly. On the one hand, you've got the manual leak, a simple typo, a missed verification, and boom, you've created a financial black hole right from day one. But on the other hand, we have the AI fix. We're talking about automation that instantly validates eligibility and captures all the documents. It's all about getting a solid, error-free start.
Okay, on to stage 2, prior authorization and benefit review. This is all about getting the green light from the insurance company before you provide certain services, and you absolutely cannot skip this step. If you do, you're basically providing care that you're never, ever going to get paid for. It's a huge risk.
And you can probably guess, this is the next major leak in our pipe. Can you imagine trying to manually track all of these authorizations for dozens or even hundreds of residents? It's a nightmare. It's so easy to miss one, and that leads directly to a denied claim. But the AI fix, well, it acts like a super organized assistant, automatically tracking every single approval and its limits. It's a total financial safeguard.
All right, stage 3 is all about clinical documentation. And let's be clear, this is the evidence. Every note from a nurse, a therapist, a doctor, it's not just a record of the amazing care being provided, it's the fundamental proof you need to justify the bill. You've probably heard this before, but it is so true. From a billing perspective, if it wasn't documented, it didn't happen, period. This is where you can really see that direct line between care and cash. Weak, inconsistent, or incomplete notes, that's going to lead to a weak claim that's easy to deny. But look at the AI fix. It acts like a quality control expert, constantly scanning all that documentation to flag gaps or inconsistencies long before they have a chance to become a real problem. Okay, hold on. Before we jump into the next stage, we gotta get our heads around a super important acronym, PDPM. That stands for the Patient-Driven Payment Model. Basically, this is the system Medicare uses to figure out how much to pay a facility, and it's not just a flat rate for everyone. The payment is based on each individual resident's specific needs and characteristics. And where does all that info come from? It comes from something called the MDS assessment, which is really just a super detailed clinical snapshot of the resident. So you see how this all connects? That clinical documentation we just talked about in stage 3, this is where it becomes absolutely vital. If the data in that MDS assessment is inaccurate, well, the PDPM rate is going to be wrong, which almost always means the facility gets underpaid. That's a huge leak. The AI fix here is brilliant. It actually cross-references the MDS data against all those clinical notes to make sure everything lines up. This way the facility gets paid correctly for the true level of care they're providing. We're at the halfway point, stage 5, charge capture and coding. Think of this like scanning items at a grocery store. Every single service, every supply, every medication, it all has to be captured and given a very specific barcode, which in this world is an ICD-10 code. This is literally how you build the itemized receipt for the final bill. Now this coding part, precision is everything. But it's also a place where human error can really cause problems. In fact, simple manual coding mistakes are one of the biggest reasons claims get denied. It's a huge source of rework and frustration. An AI-assisted system, on the other hand, can look at the documentation and suggest the right codes, which, as you can imagine, cuts down on those errors dramatically. All right, on to stage 6, claim creation and scrubbing. This is basically the final quality check. All that data we've been gathering gets pulled together into an official claim.
But before it goes out the door, it has to be scrubbed. Think of it like proofreading a super important document one last time, hunting for any mistakes or inconsistencies. Yeah, you really can think of this scrubbing process as the final gatekeeper. If you don't have a solid system here, it's way too easy for claims with mistakes to slip through the cracks, and that just leads to denials and delays you could have seen coming a mile away. An AI scrubber acts like an incredible safety net, automatically checking every single claim and flagging potential problems before they even have a chance to leave the building.
Stage 7 sounds simple, but it's so critical. Claim submission. It's just about sending the claim to the payers. But here's the deal. These payers have super strict deadlines. Missing one can directly hurt a facility's cash flow. When it comes to this step, timeliness is absolutely everything.
And the difference here is really all about momentum. Manual workflows, they can get bogged down, they can stall out, and that means missed deadlines and delayed payments. The AI fix, though, is all about speed and reliability. An automated workflow just makes sure that every single clean claim gets out the door on time, every time. That's how you keep cash flow moving and predictable.
Okay, now for the good part. Money is coming in the door. This is stage 8, payment posting and reconciliation. It's the process of taking the payments you get from insurers and matching them up to the right resident accounts. But just as important, it's also about spotting any differences between what you billed and what they actually paid.
You know, done manually, this step can turn into a total accounting nightmare. One little posting error and it becomes almost impossible to tell if you've been underpaid. But with AI, the whole thing is automated. It posts the payments with perfect accuracy and, this is the best part, it instantly flags any time the payment doesn't match the bill so you can look into it right away. So what happens when, despite everything, a claim still gets denied? Well, that brings us to stage 9, denial management and appeals. And the really important mindset shift here is to see a denial not just as lost money, but as incredibly valuable feedback. It's like a little red flag telling you that there's a weakness somewhere back in one of the steps we just covered. And this right here is the huge difference between being reactive and being proactive. The old manual way is just chasing down individual denials one by one. That's like playing whack-a-mole, plugging one leak in the pipe just as another one springs open. The AI approach, though, is so much smarter. It uses analytics to find the root cause of the denials, so you can fix the actual pipe instead of just patching the holes.
And that brings us to our final stage, number 10, which is all about continuous optimization and reporting. Because a healthy revenue cycle isn't something you just fix and then forget about. It's not a static thing. It needs constant monitoring, constant learning, and constant improvement to really perform at its best.
There's an old saying, you can't fix what you can't see, and it is absolutely true here. Without clear data, trying to spot trends or find areas to improve is just a guessing game. But an AI-powered dashboard, that gives you a real-time, high-level view of the entire revenue cycle. It turns all that raw data into actual insights you can use to make smart, strategic decisions. So, after we've gone through all 10 of these stages, after we've plugged every potential leak, what's the ultimate goal? What are we aiming for? It's this simple, powerful number, 0, as in 0 preventable denials. Now, I know that sounds like a crazy ambitious target, but with a fully tuned, AI-driven system, it's actually an achievable goal. And all of this brings us back to that one big question. Is your revenue cycle a leaky pipe, dripping away money with every little mistake? Or is it a high-performance engine firing on all cylinders? Because really, learning how to transform those small, hidden leaks into a powerful and efficient financial machine, well, that's what separates the good facilities from the truly great ones.